Hi everyone, this is Dr. Savita, working as lecturer in the Department of Pathology at School of Allied Health Sciences, Arupati Medical College and Hospital Campus, Puducherry. Today, we are going to discuss about our first module in chronic obstructive pulmonary diseases, which is chronic bronchitis. Objectives of today's topics are definition, etiology, pathogenesis, gross, microscopic features and complications. What is COPD? Acronym of COPD is chronic obstructive pulmonary diseases. It is defined as a disease characterized by airflow limitation that is not fully reversible. It includes mainly two diseases. One is chronic bronchitis. It is a long-term inflammation of the bronchi. Another one is emphysema. The air sacs in the lungs are damaged. Chronic bronchitis. Definition of chronic bronchitis. It is defined clinically as persistent cough with sputum production for at least 3 months in at least 2 consecutive years. This is a picture depicting the difference between the normal bronchi and bronchitis. In normal bronchi, the airway is normal without inflammation, mucus overproduction and smooth muscle hypertrophy. In bronchitis, there is inflammation, smooth muscle hypertrophy and mucus overproduction. Now, let us discuss about the etiology for chronic bronchitis, mainly caused by cigarette smoking due to nicotine, toxic industrial inhalant. Few examples such as sodium hydroxide, nitrogen, occupational dust exposure, respiratory tract infection like bacterial, viral and fungal infection. It may irritate and promote the bronchitis. Pathogenesis of chronic bronchitis. Chronic irritation of the mucosa by the environmental irritants will cause 3 pathogenic mechanisms. First one, it causes hypersecretion of mucus, hypertrophy of submucosal gland in larger airways, marked increase in goblet cells of smaller airways, causes excessive mucus production, finally leads to airway obstruction. Another mechanism, it causes inflammation, smooth muscle hypertrophy and peribronchial fibrosis in smaller airways. Finally, chronic irritation of the mucosa can lead to squamous metaplasia of the respiratory epithelium. This is the picture representing the hypersecretion of mucus by the hyperplasia, hypertrophy of the submucosal gland in larger airways, trachea and bronchi. Hyperplasia, increase in the number, hypertrophy, increase in the size of the submucosal glands leads to mucus overproduction. Marked increase of goblet cells in smaller airways, small bronchi and bronchioles. The primary function of goblet cells is to secrete mucus. Due to this increase in the goblet cells, it leads to excessive mucus production, leads to airway obstruction. Morphology, gross feature. This picture represents the thickening of the mucous membrane. This one represents the excess mucus and mucopurulent secretions in the lumen. Mucopurulent means combination of mucus and pus. In this slide, we are discussing about the microscopic features of the chronic bronchitis. So, this is the picture representing between the normal and abnormal thing. In normal thing, normally the respiratory epithelium is lined by ciliated columnar epithelium. But Due to this irritation, there is transition of the ciliated columnar epithelium to the squamous metaplasia, mucus gland hyperplasia, and also there will be chronic inflammations of the airways. Clinical features. Mainly it affect the middle-aged men who are heavy smokers. Cardinal symptom for chronic bronchitis. The patient will suffer from persistent cough with expectoration for many years. Over the period, the patient develops dyspnea, shortness of breath, hypercapnia, buildup of carbon dioxide in your bloodstream, hypoxia, and absence of enough oxygen in the tissues to sustain body functions. Mild cyanosis, bluish or grayish discoloration of skin and nails. Finally, we are going to discuss about the complications of chronic bronchitis. Cor pulmonale. Cor is heart, pulmonale is lungs. Due to the high blood pressure in the pulmonary blood vessels caused by chronic lung diseases, there will be enlargement of the right side of the heart. If it is progressed, it can even cause heart failure. Thank you. So this is all about the chronic bronchitis. Never stop learning because life never stops teaching. We'll meet you in the next module of COPD. Thank you.